Hello and welcome to our Digital Health Huddle Pitching and Polling presented by Chesapeake Digital Health Exchange and Anchor Ventures. I'm Jasmine McNeil. I am the program manager for the Hexcite Accelerator program, which is featured in today's pitch event. And I also lead the design team at the Johns Hopkins Technology Innovation Center, which hosts Hexcite. Hexcite is an early stage accelerator program. It is built from the talents of Johns Hopkins and the local Maryland ecosystem, with the goal of solving clinical problems through medical software. Clinicians at Johns Hopkins apply for the program with clinical problems that could be solved using a digital health product. Successful applicants are paired with teammates, including business, design, and technical leads. The teams then go through 16 weeks of rigorous technical and design training to build the digital health product. So, they work on customer discovery. They develop their prototype. They are paired with successful teammates, and they produce a Johns Hopkins pilot. This is how Hexcite used to look. You can see that the teams work together in an in-person setting. But of course, this year looked a little bit different. They worked together virtually. They did onboarding, matching workshops, and they met virtually. Still, the teams persevered, or perhaps they thrived, and they completed the challenge of more than 40 customer interviews. They developed a demo prototype, and now they are preparing to get funding and run a pilot. All of this has led us to our final virtual pitch event here today with cohort 6 of the Hexcite program. Before we begin the final pitch event, I did want to go over with you all some virtual housekeeping tips. So I'm going to go ahead and share those. So how to engage with us today? We invite you all to chat. Go ahead and use the chat to introduce yourselves, tell us where you're from. Use the chat to ask questions of today's presenters. They won't be able to respond in person, but they will be able to respond via chat. They have other team members who are happy to respond to your questions. Today is about pitching, but it's also about polling. So make sure that you respond to the polls. They are anonymous, so don't worry about that. We will have a number of trivia polls in between today's pitches, and we think that they'll be fun if you all participate. Also at the end, there is the audience choice, so be sure to stick around till the end so that you can choose the final audience choice. The best screen format for presenters today, they will be sharing their slides. So side-by-side mode, if you haven't already chosen that, is a good way to view the pitches. And when you open side-by-side mode, the slides are rather big, the speaker is small. So if you click in between those two things and drag it out, you'll be able to see both of those a little bit more evenly. And with that, I'd like to introduce you to today's MC, Ash Davison, who is assistant professor at Johns Hopkins Medicine, but she's also most recently been heading up some of Amazon Web Services work with academic medical centers. And Ash is going to lead you through today's event. So with that, I'll hand it over to Ash.
Great. Thanks, Jasmine. Can you hear me? Can I get a thumbs up? All right. All right. I got a thumbs up from the judges. I'm feeling good. Welcome, everyone. I cannot believe that it's been a year since we put together the virtual pitch last year. And I just wanted to, acknowledge that what a year it's been. And, congrats to the teams that are presenting today, but also that we're thinking about everyone around the country and around the globe during this really unique time in history where I think we're seeing the acceleration of digital transformation and demands on healthcare IT and healthcare professionals in a way that is unprecedented. It was really great to see that over 200 people had registered for today's webinar. I see that, the likes of Dr. Stuart Ray are on. So thank you all, whether you're in the research lab, on the wards, working in industry, supporting individuals around the globe in fighting the pandemic. Welcome. Our agenda for today, I'm going to be handing it off to Mark Comiskey in just a moment to be providing an overview of Chesapeake Digital Health Exchange. We'll then be hearing the 10-minute pitches from each team. The judges will have a moment to respond to each of the teams, give them some feedback. We'll be interspersing trivia breaks, and then we'll announce the winners. So great agenda for today. Thanks for joining us on this Friday afternoon. And without further ado, I would like to hand it off to my colleague at Johns Hopkins, and really someone who shepherded each of these teams through the 16-week cohort, Mark Comiskey. Mark, take it away.
Thanks, Ash. I appreciate it. I'm so happy to be sponsoring this Hexcite event with Anchor Ventures. I'm pleased to see the teams here today. Thanks to Johns Hopkins, JHTV, and the University of Maryland for supporting this event and the Hexcite program overall. Hexcite is part of a broader effort that I'm leading with the Chesapeake Digital Health Exchange, or CDHX. CDHX is a 3-year grant-funded program from the U.S. Department of Commerce to improve the regional ecosystem for digital health startups. In short, our goal is to make it easier for digital health entrepreneurs and startups to succeed in this area. We're fortunate to have so many assets in the local region. We've got leading university researchers, we've got major government agencies like the FDA, the NIH, and NSA. We've got a highly talented workforce, and we've got a broad support for entrepreneurs and startups at the local level and on the regional level. Our real goal here is to strive to connect the right entrepreneurs with the right investors, customers, and strategic partners at the right time. We want to make sure we get the right stage of development connected to the right partner and the right customer as they're moving through their startup journey. We work with a lot of universities, with other incubators, with other accelerators and partners, really to leverage the resources that the region has to offer and really bringing that to bear for all the startups in the region. We market the region to attract outside capital from outside the region, and we're also looking for folks, obviously, who would like to become employed by our startups in this area. We support job training and workforce development, and we're really excited to basically be putting on shows just like this today. This is the 2nd year we've been sponsoring the Hexcite event, and it's really great to do these virtual events. Certainly, as Ash said, COVID has really highlighted the importance of digital health as we go forward. For further information about CDHX, please go to our website, chesapeakedhx.org, and sign up. And thank you all for being with us today. And now a few comments from Dr. Brian Hasselfeld, the Medical Director for Telemedicine and Digital Health here at Johns Hopkins.
Great, thanks, Mark. Much appreciated. We'll go no slides here and keep this a little more friendly. Thanks to Mark, thanks to Ash and Jasmine, and all leaders across the institution who have supported this work over the course of the last year. And congratulations to those who have made their way through the accelerator process. There's been nothing positive about this pandemic. Let's start there. But that said, it has forced a year of unprecedented pace of change in the use of digital tools and virtual care delivery. Many have heard me talk about this scope of change. For instance, 1,000 times increase in our ambulatory virtual care, going from 50 scheduled visits a day to over 90,000 in April and May, still over 60,000 last month. We've touched over 310,000 unique patients over the course of the last 14 months through virtual technologies and scheduled care. Those patients are speaking loudly, highly satisfied, 94 out of 100 rating our providers in 72,000 surveys. They're speaking about expectations, 88% saying it's at least moderately important to have access to virtual care going forward. Our providers are responding equally excitedly and with their own expectations. An internal survey that had over 1,300 Hopkins providers, not just physicians, but physicians, speech language pathologists, nurses, PT, OT, every type of provider that touches patients, or had an opportunity to respond about their own expectations going forward around use of virtual care. They're responding the same. We expect a high amount of virtual care going forward. When asked how much do you want in your ambulatory schedule, they responded median result, 30%. That's even more than what we're doing now. We were at 28% in the last quarter. With digital tools though, it creates new opportunity, but it's also going to create some new risks. The home is now again the center of care as it was a century ago. We can more easily meet patients where they are, where they live. But with that transition comes an opportunity and a risk of massive increases in data. My own patient last week used to send me three blood pressure readings. Those were based on 3 in-office visits. Last month, she sent me 30. with 100 times as much data, what am I going to do with that data? How do I make it more usable? And how do I use that data to create a better opportunity for patients and providers? Our online portal has exploded, both in enrollment and in use. Our initial digital door used to touch just under half of our patients. Now it's touching nearly 70%. Use of interactive communication through that portal has gone up nearly 300% from pre-pandemic to current rates. How do we make that communication more intelligent? How do we make it a better experience for patient and provider? Use of technology is not distributed equally, and I'll end here. How do we ensure that digital health becomes a tool to address health equity and not one that widens it? Our providers feel that patient internet access is the #1 barrier to the expansion of virtual tools going forward. In discussion with local government here in Baltimore just this week, internet access was described as, quote, a public health crisis. I think that's fair. How do we make technology more accessible and improve digital literacy, thus creating a more equitable experience for all? I'll say congratulations again to those that have made their way through this journey over the course of last year. And again, thanks to Mark, Ash, Jasmine, and all the judges who will help participate and contribute today. And we look forward to hearing about these new fantastic ideas that will surely change the experience of providers and patients around our city, region, and country going forward. And thanks again. I'll turn it back over to Ash.
Great. Thanks so much, Brian, for those words. I know it's certainly been quite the trajectory, and really appreciate all the work you and the team in the Office of Telemedicine are doing at Johns Hopkins to accelerate digital health transformation. At this time, I have the honor of introducing our esteemed panel. I know that Jasmine will be spotlighting each of our judges, and everyone will get a chance to hear feedback from them throughout the course of this afternoon. First up, we have Eileen O'Rourke. Eileen is the Chief Financial Officer at the Able Foundation, and she has over 3 decades of experience in finance, business management, strategic planning, and operational excellence. We're lucky to have her here and look forward to hearing her thoughts on each of the teams. Next up, we have Christopher College. Chris is a well-known entity when it comes to pitching and polling in our Hexcite judging events. Thanks so much for joining us, Chris. He's a managing partner at TCP Venture Capital with expertise in structuring, negotiating, and executing transactions. He's successfully closed transactions in his career worth over $2 billion. So thanks again, Chris. Great to have you back. And we also have Troy LeMail-Stovall. He's the CEO and Executive Director of TEDCO. Welcome, Troy. We're thrilled to hear your expertise in entrepreneurial funding, resources, and connections for each of these early stage technology and startup pitches here today. Troy actually has his Master's of Science in Computer Science from Stanford and an MBA from Harvard. So we are certainly in good company here. And I think at this time, Jasmine, it's time for our first pitch.